Good morning, it's Dr. Garrett, and today I want to talk to you a little bit about what the difference is between diabetes and insulin resistance. This is something that we're seeing in the clinic a lot more often. We're having patients come in saying, hey, I see my primary doctor, I've got all these medications, I've done all these lifestyle changes, but my A1C keeps creeping up. So let's talk about what A1C is. A1C is a blood test that looks at an average of your blood sugars over the past 3 months or so. We typically want that to be about 5.6 or less, and that lets us know that your pancreas, this little organ down here, is secreting enough insulin to cover the sugars you're eating. Now, how does this work? Let's say you eat a donut for breakfast. You eat that donut, your body recognizes all the sugars as it's coming in through the different enzymes in the mouth and in the stomach, and so that pancreas starts secreting insulin. Insulin's job is to find the sugars, bind to it, and then it will store it as fat or it'll remove it from the body, depending on what the needs of the body is. In a perfect system, this works amazing and your body does a great job of doing what it's supposed to. Regardless of whether you eat a banana or you eat a donut, in a perfect system, your body gets rid of what it doesn't need. So then what happens in a disease system when you develop diabetes is that pancreas is tired of shooting out insulin. So you eat the donut and now you have all these excessive sugars in your body, and the pancreas is like, I don't care, I'm not touching it, do whatever you want. And so we're not getting that insulin secretion. So then what that does is that causes the circulating glucose or your blood sugar to go up. And we are looking at this either through a finger stick or looking at those A1Cs to see what your blood sugar levels are. Now, in a person that has something else going on called insulin resistance, this is completely different. So what has happened is over time, that pancreas is still secreting insulin. It's just not binding to that sugar anymore. Instead, it's just bouncing off. So how do we tell the difference between insulin resistance and diabetes? We're looking at a random insulin level. So we're drawing your blood. Not only are we looking at the A1Cs, we're looking at CRPs and things like this to see if there's inflammation, but we're also looking at a random insulin. So what tells us if you have hyperinsulinemia or insulin resistance is if this insulin level is above the upper limits of normal. The higher it is, the more insulin resistance you've got. So imagine me taking a ball and wanting it to stick in the drywall. So I hit it across the room as hard as I can. If your pancreas and the insulin and the sugars are absorbing the way that they're supposed to, it's going to go through the drywall and stick. However, with insulin resistance, when I throw the ball, it's going to bounce off. And that's what happens with that insulin. The pancreas is doing its job. It's secreting the insulin. It's just not sticking to the sugar the way that it is designed to. There are a couple things that we can do to help with this just more naturally. Medications, we're going to continue giving you medications and your A1Cs are going to go up and up and up. Whether that's metformin, Jardiance, Trulicity, whatever, they're just going to continue to rise. You're going to say, I have changed my diet, I don't eat that much sugar, I don't do this. And that's okay, we understand that and we believe you. The problem is in your chemistry. So there's a couple things we want you to do. One, I'm not a big fan of intermittent fasting in this group of patients. And I love intermittent fasting for a lot of reasons. However, this is going to cause fluctuations in the blood sugars, which is going to cause the pancreas to want to secrete more insulin. And then you're going to have this insulin resistance. And it's a perpetuating cycle. So the worse it is, the worse it becomes. So what we want you to do is we want you to do several small meals through the day. I never want you to break a fast, so you went to bed at night, you wake up the next morning and you're gonna have breakfast with a carbohydrate. I really want you to break that fast with a protein or a fat. Then about an hour later, you can have a carbohydrate. So no biscuits and gravy, no bacon, you can have bacon, no sandwiches, no bagels, nothing like that. We want you to do a protein and a fat to break your fast. And then, like I said, an hour later, you can have some bread or a biscuit or whatever it is that you're wanting. Obviously, we do want you to keep these healthy choices because that's more important than anything. We want you to increase the foods and the vitamins and supplements that will help your body to absorb and to utilize the different nutrients and to help with this insulin resistance. So a lot of times that's having you do some chromium to make sure that you've got cinnamon in your system. Sometimes that's berberine just to help balance out the blood sugars. Sometimes that's things like alpha lipoic acid just to kind of bring things up and help to reset the balance. So, if you find that you're a patient who, despite everything that you're doing right, you're going to your doctor, your A1Cs keep going up and up and up, ask them to check your random insulin, because more than likely this is hyperinsulinemia or insulin resistance. If you have any questions, please let us know.